Hey mamas, so I have my first prenatal appointment this week. I am about 7.5 weeks pregnant, or at least that's the date that they gave me, like based off my last period. So that will likely change today, maybe not, but oftentimes it will, just because with today's appointment they'll do a vaginal ultrasound so that they can see if like baby is looking okay. They try to find a heartbeat and they measure it from head to rump, which gives them about an estimated due date. And so usually it changes from when like you last had your period. So if you haven't seen the last video, I have been feeling super nauseous, having bad morning sickness, so I'll definitely be sharing that with my OB that I'm seeing today. I'm actually not seeing my OB, I'm seeing someone who works closely with her, and then the rest of the appointments I'll be meeting with her, like meeting with my OB. But I'm meeting with a new OB today, and I'll definitely discuss the morning sickness with her, although I'm pretty sure that I'm doing all the things that I can do naturally already, and I don't want to take any medication at this point. It's not bad enough to do that, but that's always an option for mamas who are experiencing really severe morning sickness, if they can't keep anything down and it's really keeping them from like helping supply their own body and their baby's growing body with the nutrition that it needs. But I'm feeling really disgusting this morning, but I managed to put some makeup on and curl my hair so that I don't look like I'm a crazy person walking into the hospital. But I'll kind of let you know how, you know, the appointment goes. I'll walk you through it a little bit. I don't know if I'm going to bring in my camera quite yet into the hospital, just because of COVID, and if you're going to catch COVID anywhere, it's going to be at a hospital. Although I know that all the hospitals they're just being really cautious and taking all the precautions they can to make sure that they're providing the best safety for their patients, especially their mamas. So I haven't decided. I'll let you know if I do. I'm bummed because James can't come into this appointment, and so for all the mamas who are dealing with facing their first pregnancy and kind of going to those first appointments by themselves and not having their partner with them, I really feel for you. If this were my first pregnancy, I think it would be a lot harder than the second time around, just because I kind of know what to expect. And honestly, with the second baby, like I've said before, sometimes I'm like, oh yeah, I'm pregnant, just because there's so many things going on. But I'm so grateful for this life growing inside of me, and I'm so anxious and excited and hopeful that baby's doing really well, and it's doing healthy, and so I'm excited to kind of get that confirmation. So I'll let you guys know how it goes. I also had to find a really far parking spot, but that actually worked out in my favor because then I could talk to you really quick. But bring water or drink water before you come, because you're gonna have to pee before your appointment, and then they test the pee, so you got to make sure you're able to pee before you go in, if you know what I mean. Okay. Bye. Not my most attractive look, but we're here getting all checked out. She's gonna do a vaginal ultrasound right now so I can see how baby's doing. So we'll see how that little bean is growing, and I'm excited. Very fashionable. You have to get completely naked, or at least here you do. So pretty risque. So they wouldn't let me video the heartbeat, but everything looks good and sounds good. Baby's great, healthy, and measuring at 7 weeks 3 days, so pretty much exactly what we thought from my from when my last period was. So now we are just going over some paperwork and scheduling out some appointments for the future. They're doing more telephone appointments right now, which is awesome. Makes it so you don't have to come in, because usually the appointments, especially at a hospital, are really quick. They're like 15-minute long, and so it's kind of like, well, why did I come in, especially if you don't get an ultrasound? And so that's what so we'll be doing the telephone, the telehealth. So we'll just be doing our next appointment on the phone, and then the other ones I'll go in and see my doctor. So they give you this whole booklet, at least my hospital does, that you'll bring into like all your appointments, and it has tons of information, so I'll show you more on that later. Okay, back in the car. The appointment is done. Good appointment. I was really impressed by the care and the time that they spent explaining things to me. I know if I was a first-time mom, I would be really appreciative of the way of how thorough they were sharing, just like what to expect in the coming weeks, things I can do if I'm experiencing some symptoms, you know, with nausea, and all of the things that she recommended are things that I'm already doing. The ginger tea, or in fact, I'm drinking, oh no, my tea bag broke. But anyways, typically I drink iced ginger tea, and that way it's like, it's not something that I have to like drink hot, because it's a pretty hot day here, and but ginger is super settling, like my OB was saying that I just met with, and like I've said before, and so iced ginger tea, it's just really subtle, but it's really great for nausea. But she was saying ginger, peppermint, as well as B6, which is definitely something I should be taking, and I have some at home and I just haven't been taking it, so I need to start taking that for my nausea. And then there's some over-the-counter things that you can also take if your nausea and vomiting gets really bad, but I don't, it hasn't gotten to that point. So, oh, I have a little picture, let me show you. Ugh, if I can get it. So you can't even see. Well, I mean, you can see that little thingy right there, right? That's our little bean, our little peanut. So that was really nice to hear the heartbeat. It was so reassuring. Sometimes because the baby is so little, it takes them a little bit of time to like find it sometimes, and so it's like a few seconds of like being really nervous and feeling like, oh my gosh, is there a baby in there? And then when they're like finding the heartbeat, they have to kind of stick the probe in and really like get it in there to hear it. And so again, it is a little bit overwhelming at first if you don't see the baby or hear the baby's heartbeat right away. So for those of you who are experiencing this for the first time, I want you to remember that your OB does this every single day, and so this is just their job to them. And so sometimes you have to ask them to walk you through what's happening, and you have to ask them, you know, how they are doing the ultrasound, because to them they do this every day. And so I remember from my first pregnancy thinking that they were going to do an ultrasound on my belly, but they can't do that early on because the baby is so small that they can't pick up anything, and so they have to do a vaginal ultrasound. And so they stick in a probe, which is pretty long, but it's slender, but they stick it up by your cervix, and so you do kind of feel the pressure and the coldness of it, and then that way they're able to get the ultrasound. But it's something that if it hasn't happened before, it kind of throws you off guard, because you're expecting a like on the tummy ultrasound, because you never see in the movies, or you don't really talk about having a vaginal ultrasound. So something to be aware of if you are going in for the very first time. Another thing to think about, so I was due for a pap smear, and so the nurse who was in there said, I see you're due for a pap smear, so we're gonna go ahead and do that today. And a pap smear there's no reason why I would decline getting a pap smear, because pap smears are the best way that you can prevent cervical cancer and then treat it if you have it early on. But it's the way that she asked that I want you to draw your attention to, because she did not ask really for my consent. That is not informed consent. To say, I'm going to give you a pap smear today, okay? Just because you have that okay question at the end does not mean it's informed consent. And so, of course, with the pap smear, there would be no reason for me not to get it. There would be no reason for me to have informed refusal. But I was not informed on what a pap smear was, although I've gotten one before, so I know what it is. And she did not ask. She did not say, I see you're due for a pap smear. Would you consider having your pap smear done today? Can I share more about it with you if you're uncertain on what it is? That is opening the door for discussion. And so I just want to draw your attention to that in this video, because that is something that you are going to have to advocate for yourself from the beginning of your pregnancy through the end of your birth. Is that a lot of times, unfortunately, their informed consent is not true informed consent. It's, I'm going to do a vaginal exam now, okay? Or we're going to start a Pitocin drip, okay? And so it's so important that you say, wait, I don't know enough about that, tell me more, and then we'll discuss it. And that would be true informed consent or refusal. But just because they say okay doesn't mean that you have to say okay back and allow it to happen. So that little quick note for you mamas who are starting off this pregnancy or who are already very pregnant and watching this, it is their job as a care provider to provide you with information so that you can make an informed decision, whether that's consenting to what they want to do or refusing what they want to do, and just opening up that door for that conversation to be had. So that's my important story and piece of advice for you in this video. So I can't wait to, I don't know, keep going and share this experience with you. I feel like I say that every time I end a video, but honestly, I'm so excited to share this experience with you. But I'm gonna head home. I'm gonna turn on the AC in my car because I'm super hot, and I will see you next time. Bye, mamas.